A good physician treats the disease. A great physician treats the patient with the disease. A very good evening to you. Welcome to Doctors on Call. It is yet another week which we're excited about, by the way. So we will be live at 8 p.m. on Monday, Tuesdays, and Thursdays. And tomorrow we are expecting a chiropractor. I know it's been a while since we had one, together with a diabetic food specialist. On Thursday, later on, we'll be having a kidney specialist together with a nutritionist as you get to tell her whether you have achieved your dietary needs. So for this particular evening, it's matters pertaining to our mental health together with, I'm joined also with a general practitioner. So first up, I have with me an award-winning doctor, Dr. Syengo Mutisya. Thank you so much for coming in onto the show. She is a psychiatrist. We are glad to have you.
Thank you very much.
You're an award winner, doctor, so people should know about that as well. Okay, but of course, it's always a pleasure having you on the show. Also joining me in the studio, we share the same name. I'm George Oraro Otieno, he's Dr. George Otieno. So the only thing that will be differentiating us this particular evening is the title, Dr. Daktari. Thank you so much for coming in onto the show.
Welcome.
It is a pleasure having you.
Thank you.
Dr. George Otieno is a general practitioner, so this is where it gets interesting. Being that this show is tailored for you and it's all about you, get to talk to us on 22316. That's the SMS line. Of course, you can include your name, where you're watching us from, or listening, being that we are on Family Radio 316 as well. Remember, you can call in the studio. We have two numbers that I'm going to give to you. The first one is 0721-830-138. Alternatively, use 0735454647. So remember, you can start getting in touch with the doctors as early as right now. And the first question I'm going to pose to you is from, of course, Olo Bernard. A very important question that is raising up. He says there are homes for the crippled, the blind, and the deaf. Why are the mentally challenged neglected? How will you respond to that? Because there's a lot of stigma when it comes to mental health. So what's your take? How could you respond to Bernard's question?
Okay, if the mentally challenged actually would be best taken care of by family members, because it's that extra love you would get from family members. But the challenge is the facilities which could actually facilitate their social skills learning and also their academic at their level. The basics learning to get to know how to do the activities of life might not be available, and so it becomes a big challenge, and so that's why most parents who are taking care of probably children or even adults with the mental handicap would actually have to lock them up to be able to go and earn a daily living, and it's a big challenge. But I would also want to differentiate mental handicap and mental illness.
Of course. Because
mental illness is a disease which can be treated and the person stabilizes, as opposed to what we call mental disability. Where the person might never come back, might never achieve full intelligence, but they are able to learn as per their mental age. Yes.
Okay, thank you for that clarification. And of course, Bernard Olo, thank you for your question. He's tuned in Kisumu. For the second question, I'm going to take it up from one of our listeners on Family Radio 316. He or she hasn't quite indicated the name, but it's about a lifestyle, a particular lifestyle disease. When it comes to diabetes, he or she wants to know whether it can be treated.
Okay. So diabetes, together with many other diseases like hypertension, things like heart attack, are generally classified as non-communicable, to mean they are brought about by lifestyle issues. And so if one, generally we recommend that the general population, people who have not been diagnosed with diabetes, to keep checking yearly their blood sugars and their blood pressures, so that you are able to pick it earlier before it gives complications. So once someone has been diagnosed with diabetes, then there are drugs that can be given. Of course, we start with lifestyle, where we ask them to exercise 30 minutes every day, making sure that they break a sweat. And also, we discuss with a nutritionist. They're able to discuss which nutritional intakes are appropriate for them. And usually they are treated well when when you follow the treatment and the instructions. The disease can be controlled properly. There's no need to fear, and so.
But the issue here is treatment, so it can't be treated, but it can be controlled.
The issue is you control the blood sugar, but when you stop the medication that you are on, or when you neglect those lifestyle issues, then the complications are bound to happen. So basically, it's controlled, not cured.
Okay, thank you for that particular response. Of course, Dr. Mutisya, I want to bring you in on this. We just mentioned about diabetes, which is a lifestyle disease, and until recently I came to know of that stress is actually classified as a lifestyle disease, and we see a lot of situation in our current setup that lead to stress and eventually might lead to depression. So coping with stress, how should we go about this, Dr. Mutisya?
Yes, basically everybody needs to adapt the right lifestyle. Make sure that in your life you have exercise, make sure that in your life you are eating healthy, and make sure that you are able to prioritize your roles and be able to take up what you can cope. Because we will all face stress at any given time, and if you are not able to actually balance, it can lead to breakdown. But there are things, we usually advise our clients that the things you can't change, then you actually need to learn how to live with them. But the ones you can change, you can try and change. When stress is too much and the person cannot handle, then they could break down and get depression. Yes.
So basically is living within your limits.
Sort of, yes.
A proper way to put it. So we're getting questions on 22316 in case you're wondering the number to send it to. And remember, you can call in as well. The contact information should be running below the screen, the number. But I'll repeat them for the benefit of people who are listening on Family Radio 316. You can get us on 0721 830138. Alternatively, use 0735454647. I'm going to pick up a question from Lucy, actually. This is a question that I received earlier on before coming on air, and I'm going to read it the way it is. And Lucy was diagnosed with HTN. That's how she puts it. And this was last year. She's on medication, but when she does not even take one single day, she gets headaches and blood pressure shoots high. So she's asking what she can do to manage this and stop medication. How could you advise Lucy? And what's this HTN?
So HTN is an initial that we use to refer to hypertension.
Hypertension.
Basically high blood pressure. And the advice to Lucy is, from her report, it appears that she mixes her drugs sometimes. She doesn't take her drug, and usually hypertension is, high blood pressure is a disease that you control using the drugs that are prescribed. So when you stop to take those drugs, then the pressure is bound to go up, and one of the symptoms of knowing that your pressure is up is actually the headache that she's referring to. So every time she has a patient with high blood pressure has headache or dizziness, then it's important for them to check their blood pressure. She's also alluded to the fact that she would like to stop medication. It is important for her to know that once you are started on these drugs, you cannot stop them unless otherwise advised by the doctor. But usually, when you take the drugs appropriately, then your pressure gets controlled and those symptoms tend to disappear.
But Dr. Otieno, what if in defense I come to you and say, I can maintain it, it's well maintained, so can I stop my medication and control it using diet? Is it possible?
Usually what we don't realize that when our blood pressure is controlled, it is because you're taking the drugs. So when you ask, can I stop my drugs because my pressure is controlled, it's like you're not appreciating the work the drugs are doing. So we would like to advise our viewers that when your pressure is controlled, you maintain the dosage of the drug that you are on, and you keep doing the exercise, because without exercise, when you become inactive again, you may need more doses of the drug. So it's important to maintain and adhere to the lifestyle advice.
And I think Lucy should be taking her drugs religiously, if I may say.
Yes.
Dr. Mutisya, a very interesting question from Grace. Grace is tuned in on Family TV. She's sending you a text from Kinagop. She's asking you to briefly explain the relation between dementia and lifestyle. Is there any correlation in between? And what is this dementia?
Okay, dementia is actually memory loss, which would occur in not so old people. It's one of the ones we refer to as early dementia, which is progressive, and most of the time we cannot, there is no medication to reverse it. We could only slow the progress, but we cannot stop it. So as to whether lifestyle can actually change that, so far we know there is the genetic predisposition, and research is still being done to actually find out the cause of the memory loss. But because there are other causes of memory loss which can actually be eliminated, like if you have a clot in the brain or a tumor in the brain and all that. But when you're talking of dementia, we are saying you've done the investigations and we didn't find any of those. So lifestyle, I would say let everybody adapt a healthy lifestyle, but as to whether lifestyle is the one which will cause dementia, that is not entirely true, although the cause is still being researched on. Yes.
So when you talk about a healthy lifestyle, what's the definition? Because you're always being told a healthy lifestyle is where you eat properly and you go for exercises. I don't know whether your definition is quite different from that.
Yeah, although you also need to look at other aspects of a human being. Social support, for example, because, you know, as we become more urbanized, our social structures are breaking down because we are moving from the extended family, and so when you find somebody in an urban setup, when they have a problem, they don't have the support of the extended family. So social support is also very important. Spiritual well-being is also very important, in addition to the physical health. Again, aligning your thoughts, what we call mental health, to actually be sure that you, what we call cognitive distortions, that you watch out negative talk, because negative talk can actually make you either anxious or it can make you depressed. Okay. In addition to the physical health, because we say you cannot separate the physical health from the mental health. So if I have pain because I have a wound, then I will not be happy. So my mental health is affected. Likewise, if you are depressed and you can't exercise or you can't get out to go and look for money, then also they are all intertwined. So it would be very good to look at all aspects of a human being and try and balance it. Okay.
Yeah. I have a question from Naomi for you, which I'll be asking to you in a short while. But for you, Dr. Tieno, this one is anonymous, and I think I can relate to this particular question. It's talking about difficulty when it comes to swallowing, and this particular sender says it's not severe. So here she's asking what will be the cause and medication. I can relate to it actually. Yeah. It affects my diet more often.
Difficulty in swallowing.
Exactly.
Now, the word difficulty in swallowing in medicine usually is used when a patient has no other problem with eating, but then when they try to swallow food, it doesn't go in very well. So usually you know that the digestive system starts from the mouth, then the esophagus, and then the stomach. What we learned in our primary biology.
So, a long time ago.
A long time ago. So usually the problem is that there is there's some obstruction. But I will be careful to say that if I do not know the age of that patient, because the viewer who is asking that question, because there's a difference between difficulty in swallowing and pain while swallowing. So I hope they're not referring to pain, because pain is something totally different. So if you have just difficulty in swallowing, then it is important for someone to put a scope into your esophagus through the mouth and see where the mechanical obstruction is. That's the most common cause of difficulty in swallowing.
Okay, thank you so much for that. We get to hear from Naomi when we get back, but as of right now, here is why next time you should not fight in front of your children. Stay tuned, we'll be right back.
In our medical news today, children who become very upset when parents fight are more likely to develop psychological problems. According to a new study by researchers at the University of Rochester, the University of Minnesota, and the University of Notre Dame, children who are distressed when their parents fight also have higher levels of cortisol, which is a stress hormone. The researchers studied 208 primarily 6-year-olds and their mothers to determine whether children who showed specific behavior patterns of reacting to conflict also had changes in cortisol levels during simulated telephone arguments between their parents. They measured children's distress, hostility, and level of involvement in the arguments and received reports from mothers about how their children responded when parents fought at home. Cortisol levels were measured by taking saliva samples before and after the conflicts in the lab. Children who were very distressed by the conflicts in the lab had higher levels of cortisol in response to their parents fighting. The study also found that children's levels of hostility and their involvement during the arguments weren't always related to their levels of cortisol, but children who were very distressed and very involved in response to parental fighting had especially high levels of cortisol. Because higher levels of cortisol have been linked to a wide range of mental and physical health difficulties, high levels of cortisol may help explain why children who experience high levels of distress when their parents argue are more likely to experience later health problems.
Thank you so much for staying tuned to Doctors On Call. With me in the studio is Dr. Syengo Mutisya. She is a psychiatrist, together with Dr. George Otieno, my namesake. He is a general practitioner. So make sure you talk to them on 22316. Give us a call on 0721-830-138. Alternatively, be free to use 0735-454647. And based on what we've seen, of course, in most cases, children might get caught up in these conflicts, so and they can be affected in that performance in school goes down. How can you help this child get back up?
Yeah, basically children are very easy to mold when you identify the problem. So if like what we've seen, if their parents who are fighting and probably didn't know that was wrong, then once you change the environment of a child, they can easily be recover. But it is true that constant conflicts and fights for the parents can actually stress the children a lot. And so that's why we say when in a relationship, in a couple, when they find that they can actually not live in harmony and the fights are too much, sometimes for the sake of children, it's actually better off to separate than to keep fighting, because you know you find some people saying I have to be there for my children, yet you're making the life for the children even worse.
And they always do say children never forget.
Yes, they never forget. But with support, they can actually recover. That's why when you move children from a bad environment and you take them to a stable environment, they can actually catch up. Yes.
Okay, thank you for that response. I have a question from Wilson. I haven't forgotten about your question, Naomi. I'll be asking it to Dr. Mutisya in a short while. But Wilson's again is to do with HTN. And of course, first of all, he thanks you for the info that you provide. And in Wilson's case, he got HTN and was put on drugs. He says, sometimes, quote unquote, sometimes I feel like my heart is racing above normal. Is it caused by the pressure?
Okay.
Dr. Otieno.
So we need to understand that hypertension is, if not controlled, then can affect certain organs in the body, including the eye, the heart, the kidney, and even the blood vessels that supply blood to other parts of the body. So usually if you have a patient who is hypertensive,